Thank you all for being here today. We have Ryan Black with CareSource, who's going to go over all of the benefits of CareSource. We're going to go over the DSNP plan that they have both in Ohio and Georgia, as well as the ACA afterwards. So get your notes, get ready, because you'll be able to take all the notes you need to make sure you're having a successful year with CareSource this year. So without further ado, thank you so much, Ryan, for being here with us this morning.
Great, Sophia, I'm going to take it away. First off, I'm going to turn my camera off to make sure that there are no interruptions during this hour since I'm sharing my screen. So I'm going to go ahead and do that now and kick things off. So like Sophia said, I am going to be going over our Ohio DSNP, our Georgia DSNP, and our ACA. This will be all for next plan year, so plan year 2026. So we are going to start off on the DSNP side of things, specifically the new MyCare Ohio. So just a little bit of background. MyCare Ohio was a pilot program that is expiring this year, and they're doing MyCare Next Generation Ohio. So it's going to have the same name. There are 3 or 4 company carriers that will be offering this next year, and it will be a statewide program. It's going to have a little bit of a phased rollout. We'll get into that to the next slide. But essentially, to qualify for it, you have to be 21 or over. You have to be a full Quinn B+, Slim B+, and it is our full FIDE. The benefits are the 1 care coordinator to help manage the Medicare and Medicaid side of that, and 1 ID card. There will still be some coordinated SNP plans in the state, but those will be gone in entirety by 2030, and the last year you can enroll for those would be 2026. So Ohio really wants everyone to get to that full FIDE plan. It's CareSource, Anthem, Molina, and Buckeye Health might be in there. They did fail their readiness, but I assume that they're going to protest that. So we'll see. Moving on. So this is how it is going to roll out. You'll see these gray counties here. Those are the ones that go live January 1st, 2026. The reason they are doing a phased rollout is because the state wants to make sure they have adequate resources available to do this right. The next year will follow just normal AEP. To enroll in that January 1st, 2026, if they are one of your clients is in these counties, they will enroll during the normal AEP section. And then all these other ones follow with different go live dates, with everyone being live by August 1st. This map is available on the Ohio Department of Medicaid's website. So if you don't get it here, you'll be able to get it there. The big thing that CareSource is excited about, everyone knows that these clients shop by that food card. We are offering a 287 healthy benefit card. This rolls over every month. So if you don't use 287 this month, the next month you have whatever that ends up being, 564, I believe, off the top of my head. And you can save it all the way to December if you would like. Doesn't roll over to the next plan year. So make sure they use all their bucks by the end of the plan year, but it does roll over every month. And they have healthy food, over-the-counter, utilities, rent and mortgage assistance, pet care items, a whole list of everything that you see up here they can utilize that card for. Also, they can get up to $715 in rewards just by doing different tests, different surveys, etc., or getting different vaccines like their flu shot. That pays $50. If they get a second flu shot, that's another $50. They do their HRA, also known as an HNA, that's another $50 to the member. So there's a lot of opportunity for the member to take full advantage of this and get up to that $715 in additional rewards. The fully integrated MyCare plans are going to come with $0 prescription drug benefits. Now, you can still put your clients in one of those coordinated SNP plans that other carriers are offering, but they're not going to have those $0 copay prescriptions. If you have a client who is eligible, I strongly recommend you put them in one of the new MyCare generation plans, preferably with CareSource. I'm biased, but I'm not CareSource, definitely Molina or Anthem. You want to get them in that fully integrated plan. That's going to treat your client the best. Dental benefits, we are offering a $5,000 annual max allowance there. We are using Delta Dental. Previously, we had used DentaQuest, but we heard a lot of feedback from agents such as yourselves, and we have switched to Delta Dental. They will be using their commercial network, but they are adding an enhanced commercial network. They're still working with the state to get all those providers approved, but it's going to be better than the commercial network that they currently have. So that is great news. Additionally, if their $5,000 max isn't, or $5,000 supplemental allowance isn't enough for dental, they can use that healthy benefits card, that $287 per month. Here is a list of all these $0 copays, cover medical benefits, telehealth, emergency room visits, urgent care, preventative care, Part D drugs, home health care, ambulance services. All that is going to be $0. We utilize iMed for our vision. That comes with one comprehensive exam per year. If your age is 21 to 59, you get a pair of glasses every other year. But if you are 60 or older, you get a pair of glasses every single year. And they can also use that benefits card as well to supplement some of the benefits if they would prefer glasses before they're eligible for a new pair. Going on to hearing, we are continuing to use True Hearing. Every year we do a review of our dental, our vision, and our hearing benefits. We do a review with the vendors. We reach out to agents what they like best. With iMed and True Hearing, we always hear great feedback. There's never been any issues, so we haven't felt the need to change things up there. It's going to be very similar benefits to years past, but you do get those free hearing aids. And then with that hearing aid purchase, if you look down here, it's risk-free 60-day trial period, 1-year follow-up visits, 80 batteries per non-rechargeable hearing aid, which is great. And then the full 3-year manufacturing warranty. We've heard great things from our members about True Hearing, their hearing aids and the quality of those. So excited to continue that partnership with True Hearing. The fitness benefit, we utilize American Specialty Health Program, Silver and Fit. I'm sure everyone here is familiar with Silver and Fit, but just to do a really quick deep dive into it, it's a free gym membership. So if you go to silverandfit.com, on that homepage, they're going to have a spot where you can type in your zip code. Once you type in that zip code, you'll see all the gyms in the area pop up. They kind of come up like chickenpox. They're everywhere. However, in the rare event that one of your clients is in an area and they type in their zip code and there are either no gyms or not an adequate amount of gyms, please shoot me an email. I have a contact at American Specialty Health, the company that runs the Silver and Fit program, and they really look out for things like that. There have been a few occasions where I have reached out to them about a lack of gyms in a certain area, and then within 2 weeks, they've added 5, 10 gyms in that specific area. So if you do find that there aren't a good amount of gyms available in that area, don't let that stop you. Reach out to me and I will get that handled for you, because ASH, American Specialty Health, really does want to have the greatest network in the business. If you don't like to go to gyms, you can get a home fitness kit and they'll send that to you. If you do the gym membership though, so like let's say you go to Planet Fitness one day and the next day you want to go to an LA Fitness, that's totally cool. You don't have to commit to one gym. You can go to all the gyms, flip between them for whatever reason that you may want to. Transportation. So we give unlimited rides for healthcare visits, community wellness service, pharmacy, gym, and grocery stores. It's also unlimited mileage, as long as it's within our Ohio service area. So if you live in Cincinnati, Ohio, and you need to have a procedure done in the Cleveland Clinic, which is in network, we will drive you to the Cleveland Clinic. You can go there every single day if you want to. You can go to the grocery store every single day. So unlimited trips to and from healthcare visits, community wellness service, pharmacy, gym, grocery stores, and unlimited mileage. Meals. We utilize Mom's Meals. We actually, this is kind of an anecdotal story, but I'll tell it. At CareSource, when we first got introduced to Mom's Meal like 6 years ago, they came and they actually made meals for the sales team. And they were good meals. They were better than the frozen meals. I mean, that's not a 5-star Michelin restaurant type meal, but good meal, good home cooked meal. You get 2 meals per day for 14 days for a max of 28 per stay. Now, if you go to the hospital for a month and you check out and then you go next month, your meals do restart. So it's not max 28 per plan year. It's max 28 per stay. Very important to note that. This is going to be for Ohio and Georgia, but the SSBCI eligible conditions are listed here. So how this works is CMS essentially puts out a list of a whole bunch of different eligible conditions that we can then choose which ones we want. We actually chose every single one that they offered. I'm not sure what other carriers are doing, but I do know that CareSource is doing that. A question that I got during a roadshow a few weeks ago was, let's say at the beginning of the plan year when they enroll, someone is overweight or obese, and then 2 months into it, they lose the weight. Do they lose their SSBCI eligible conditions? The answer is no. Once you are eligible for the plan year. You only need to get this done once per year at the time of enrollment. And that goes with anything else that they may have that they either heal from or change. I don't know the best way to say it. We'll say heal from. But once they're eligible for the whole entire plan year. After enrollment, we pay the max CMS commissions allowed. CareSource processes the application and confirms eligibility. At that time, Medicare will then confirm eligibility. Members will receive a confirmation letter or a call and a low-income subsidy rider if they are eligible. Members receive their CareSource member ID card within a few weeks after enrollment. The new member kit arrives in the mail. During the first 90 days of enrollment, your client will receive a call from one of our care managers from our clinical care team to assist them in completing their health needs assessment, if they didn't complete that at the time of enrollment. I do want to point out in Ohio, not Georgia, so Ohio, for the first year of the MyCare Next Generation, every single month, the member can switch carriers. So they can go from Anthem in January to CareSource in February to Molina in March. Personally, I don't think that's the best policy, but that is something to be aware of. So if you do enroll a client in one of the MyCare plans in Ohio, be sure that you let them know to speak directly to you before making any switches to their plan. We want to make sure that there's no predatory agents out there who are taking advantage of these folks, because they are the most vulnerable population. So make sure that you make that as clear as possible, that if anyone reaches out to them about changing their plan, they come to you, the broker, before agreeing or having any conversations with anyone else. That protects, one, your commissions, but most importantly, it does protect the member. And that goes for whether they're in a Molina plan or an Anthem plan or a CareSource plan. Always need to speak to you before changing plans. Moving on to Georgia. So we are expanding our Georgia service area quite a bit. So the light pink here is what is all new for our DSNP side. And then the existing is the old purple. We are not exiting any counties. We are only adding a bunch of counties. So we're still not statewide completely. I talked to Jason Bearden. He's our president of Georgia. He would like to be statewide in 2027. Obviously, that is no guarantee at all, but it does show a huge commitment to the state of Georgia, and we are pursuing growth, and we are showing no signs of slowing down or pulling back. So in Georgia, there are actually going to be two DSNP plans. There's going to be the Dual Advantage and the Dual Advantage Plus. Really, the differences come down to the food allowance and stuff like that, but we'll get into that. In Georgia, it is coordinated. So it's not going to be that full integrated, it's half integrated. So it's a HIDE in Georgia, not a FIDE. I know all these terms can be a little bit confusing. So if you have any questions, please reach out to Sophia, who will then communicate with me. The specific levels of Medicaid eligibility for this in Georgia are going to be the Quin B Plus, the Slim B Plus, and full benefit dual eligibles. And obviously, you must live in the service area. So in Georgia, for the Dual Advantage plan, you get $240 monthly, and this rolls over just like in the Ohio MyCare. And the Dual Advantage Plus, you get $196. Why is the plus less? I don't know. I asked our benefits team that, and it's just how it worked out. So don't ask me that. But $240 for the Dual Advantage, $196 for the Dual Advantage Plus. And just like on the MyCare in Ohio, you can use it for pet care items, rent, mortgage assistance, healthy foods, over-the-counter items, utility, personal care such as shampoo, deodorant, lotion, and all the good stuff. And our vendor for this is going to be that Healthy Benefits. Same thing on the MyCare side of things. Just like Ohio, we give up to $715 in the CareSource rewards. It's the same exact program in the Ohio. So $50 for the HRA, $50 for flu shots, $50 for retinal eye exam. Really, CareSource does this for two reasons. One, to ensure that our member is getting the best care possible, is going to the doctor when they're supposed to, going to the dentist when they're supposed to. And two, it puts some extra money in our members' pockets. So it's a win-win as far as CareSource is concerned. We are using SkyGen for Georgia. So in Ohio, it was a $5,000 allowance. In Georgia, it's going to be a $4,000 allowance. You get the oral exam once per 6 months, cleanings once per 6 months, x-rays once per year, and then fluoride one per year, 6 months. Now, I know this allowance is slightly less than in Ohio, but keep in mind, this is a HIDE, not the FIDE plan. So while the benefits are still going to be incredible in these coordinated SNPs, they're not going to be quite up to the level of that fully integrated plan. Vision, we utilize iMed. Going to be the same benefits that you saw on the Ohio MyCare side. $500 allowance per year toward eyeglasses and frames. And $500 can get you some nice glasses. Moving on to hearing, utilizing True Hearing. $0 copays on the Dual Advantage plan. And same exact benefits on the hearing aid that you're going to see in that Ohio MyCare plan. You're going to have the 60-day trial period, 1-year follow-up, 80 batteries per non-rechargeable hearing aid, and then the 3-year manufacturer warranty. Prescription drug benefit. So again, $240 monthly on the prescription drugs. You can see the low-income subsidy cost sharing for all the Part D covered drugs. 30-day retail, 6-day retail, and 102 retail order. And again, $240 per month on that. Those cost shares, I don't believe, are technically finalized yet. When they are, I will be sure to get with Sophia on that. And the Dual Advantage Plus is $0 on the tier 1 and 2 at the $196 monthly. So you get $0 on tier 1 and 2, and then you get the additional $196 to use every month on those tier 3, 4, and 5 drugs. Moving on to transportation, same thing as in Ohio. Healthcare visits, renewal appointments with job and family services, pharmacy, gym, grocery store, unlimited trips. You can take those every single day, unlimited mileage. You can go to the grocery store in the morning and the gym in the afternoon, all on the same day. Unlimited trips, unlimited mileage. It really is a great benefit. Use Mom's Meals in Georgia, just like we did in Ohio. And again, we want to call out, it's 28 meals per stay, not per plan year. If you're checked into the hospital for a month, go out, and then next month you go back in, your meals reset. Georgia DSNP also utilizes the Silver and Fit program with American Specialty Health. I'll reiterate again, if you find an area where there aren't an adequate number of gyms to your client's liking, please reach out to me and I will work with American Specialty Health to make that right. But in the meantime, for them, while we're working on that, they can also get the home fitness kit as well. Okay, now going on to the marketplace. So I'm right where I want to be because I want to spend a lot of time on the marketplace because it is very confusing. A lot of change in my 10 years of working on the marketplace. I haven't seen anything like this. So before I start diving into the plans, I kind of want to talk about where we're at as the industry as a whole. So what you're going to see across the industry, across service areas, is premiums going to be, quite frank with you, skyrocket. I'm seeing stuff of carriers filing for anywhere between 20 and 40% premium increases. I will say CareSource isn't pushing that high, but we are double-digit premium increases pretty much across every single market. The reason for this being is, as you know, those enhanced subsidies that we got during the COVID era are expiring. Because of this, insurers are under the belief that healthy people will opt not to have health insurance or go on some type of short-term plan. But the fear is that they will opt not to have health insurance through the marketplace. Carriers believe that the main folks who will be joining the marketplace are going to be folks who absolutely need it. So those folks who have illnesses, chronic conditions, who are going to submit a lot of claims. Those are the folks that they believe the marketplace is going to capture. Because of this, to ensure that there is any possibility of being profitable from the carrier side of things, the insurance rates are going to skyrocket across the board. I'm sure that you have all read articles and everything. It is as bad as it seems at this moment in time. There are bright sides and opportunities, though, and I'm going to dive into that here soon. Personally, I believe that the carriers are kind of overreacting here. I think they're playing a better safe than sorry approach, and I think this time next year they'll look back and realize, we probably didn't need to do that, and you'll see the marketplace start to normalize again. Subsidies aren't going away entirely. It's a common misconception. It's just going back to the subsidy levels before COVID. So pre-COVID level subsidies. They're not entirely gone. Now that I've said that, let's dive into CareSource's plans. So we are going statewide in Ohio. We basically were statewide, but we are adding Knox and Athens County to service all, 12 people who probably live there. Not 12 people, it's small counties, but very small populations. So Georgia, we are adding all the dark purple. So we're not quite statewide, but we're getting there. I do want to reiterate that everything I'm showing you on the marketplace side is subject to change. States have opened up filings or pushing stuff back as carriers are negotiating rates with the states. That's not just Georgia, that's everywhere. I think we're at the point on September 2nd where we're pretty close to being finalized, but we have had changes way later than I've expected. And some changes have been huge changes, like service area changes as of last week. So all of this is technically subject to change, but I do think what I'm showing you here will more or less be the final product. Indiana, we are remaining statewide. Nevada, this is a new one for us. We are entering to Nevada for plan year 2026. I will actually be out there in 2 weeks hyping up the agents there. The main areas that you need to know are going to be that Reno, Nevada area in the north, and obviously Las Vegas. Everything else is very rural in between there. One interesting thing about Nevada, and I'm not sure if any other state does this, it's the only state in CareSource market, you have to be a residential license holder to sell there. So you must live in Nevada. So if you don't live in Nevada or you weren't grandfathered in before that rule became in effect in, I think, 2019, then you don't need to worry about Nevada. But you have to live there to sell in Nevada. One of the only states I've ever heard of it. It's very interesting. I'm assuming the intent was call centers and then wanting to protect Nevada agents. But regardless of the intent, that is what it is. So that is
that's
the
good to
rule.
know.
Yes, of course. North Carolina. Now, like all of our other states, anyone can sell here as long as you're licensed in the state. We are expanding a little bit, not a lot, but a little bit. So we're going to add that Wilmington area, which you're going to find that that's where CareSource is going to be most competitive, is in that Wilmington area, filling in Cleveland County right here and going a little bit east of Winston-Salem. Not super far, but we are adding those 4 new counties. West Virginia, we are remaining statewide. A quick note on West Virginia. If you're not selling in West Virginia, you should be. It's a very easy state to do business in. There are only 2 carriers. It's CareSource and Highmark. And CareSource will be the better plan in one rating area with better rates. And then the next rating area, Highmark will be the better plan. It's nice because in a position, in an environment where those extended subsidies are going away, a lot of folks in West Virginia on the ACA are still going to be eligible for subsidies because they're still going to meet that pre-COVID subsidy era. It's one of the lower income populations of the states that CareSource works in. So a lot of business to be had in West Virginia. So highly recommend getting involved there if you're not already. And then Wisconsin. So for those of you who know of Common Ground Health Insurance, CareSource acquired Common Ground last year, and this year they'll be under the CareSource brand. Now they have their own team up there. So if you're interested in Wisconsin, shoot me an email. I'm not going to have answers for you, but I can direct you to the right people in Wisconsin. Okay, going on to our plans. So right off the bat, what I want to show you is this HSA eligible bronze plan. So this was filed before the Big Beautiful Bill is planned. And in that Big Beautiful Bill, it states that all bronze plans are now HSA eligible, as well as catastrophic plans, but CareSource doesn't have any catastrophic plans. Just a little good to know for you. So all of these plans are HSA eligible. Because of that, I'm assuming this will be the last year of having the HSA eligible plan, because it's not really necessary anymore. But anyhow, starting left to right. So that bronze 7,500, this is formerly known as our bronze first plan. The name has changed to bronze 7,500. Why did we change the name of our most popular plan? That is besides me. I couldn't believe that we did it, but we did. So it is the bronze 7,500. This is going to be available in Indiana, Michigan, North Carolina, Ohio, and West Virginia. Our core bronze plan, which is going to be in our state-based exchanges, similar to the bronze first, just very slight differences in the weeds of cost shares. And then our low premium bronze, which is going to be in every single market but West Virginia. This low premium bronze, if you'll recall at the beginning of the presentation, I was talking about how there are going to be opportunities still on the ACA side of things. CareSource acknowledges that premiums are about to skyrocket. So we're trying to find ways to offer affordable plans. This low premium bronze is one of those. It's going to be our cheapest plan by far. But if you're looking at the coverage, it kind of shows as a catastrophic plan, right? It's got that high deductible of $10,600 that matches the out-of-pocket max, and no first dollar coverage until you hit that outside of our tier 1 and tier 2 drugs. Another thing CareSource is doing is off-exchange discounts. I'm calling them off-exchange discounts. It's not really what they're called. But every single plan that's available on exchange is also available off exchange. The only difference is those off exchange plans are going to be 10 to 15% cheaper on the premium side. So if you have a client who doesn't have any subsidies, it doesn't make any sense to enroll them on exchange. Enroll them off exchange and they'll get that 10 to 15% discount. On exchange, if they have subsidies, obviously they need to stay on exchange. So yeah, that's a good opportunity.
I love this. So for everyone that's listening and watching and taking your notes, for the low premium bronze, which is amazing, that has all these zeros, so it's really helping with the, like you mentioned, Ryan, with the offset of how the premiums will be higher, is a perfect plan to just get an additional like accident plan or hospital indemnity plan to cover that 10,000, and they're golden. So just want to make sure the agents that are learning today have that in mind. And if you're not sure which indemnity to pair it with, just reach out to us so we can advise you. But yeah, thank you, Ryan. I'll let you get going.
No, that's a great point, Sophia. Thank you for saying that. And keep in mind, that is also HSA eligible, as all bronze and catastrophic plans are now HSA eligible.
Amazing.
So it's not all bad news. There's some good news stuff here like that.
Great.
Okay, so we're also adding some off-exchange only plans. You're going to see a lot more on the silver and gold, really kind of going after that ICHRA market. But in Indiana, we're doing kind of a pilot of these off-exchange only plans. So there's going to be a bronze 7,500 plan and a low premium bronze that's going to be slightly different once you get into the weeds of things. For the most part, it's going to be the same exact plan as on exchange, but keep in mind, those are off exchange only plans. Going on to silver. So there is a whole bunch here and a change that happened just last week. So I want to say that change right now or else I'll forget. The silver 6,000 plan. This is available in Indiana, Michigan, North Carolina, Ohio, West Virginia. In the state of Ohio, we also have our chronic condition plans, our diabetes plan, our healthy heart, and our HDHP, our high deductible health plan. The only difference in rating areas 1 and 11 in Ohio. So this is going to be Toledo and Cleveland. The only silver plan that's going to be available is this silver 6,000, and that's on and off exchange. So even though these say Ohio here, they are not available in rating areas 1 and 11, which is going to be the Cleveland and Toledo metropolitan areas. Now that I have that out of the way, starting left to right, our silver 6,000, this is going to be our federal standard plan. All plans, again, that are available on exchange are available off exchange at that discount. This year on the federal standard plans for silver, the deductible has gone up to $6,000. We have our low premium plan. This is going to be in every single market except Ohio and West Virginia. kind of acts as the bronze low premium plan, right? You get that high out-of-pocket max, but the difference between the bronze and the silver low premium plan is you're still going to have first dollar coverage on quite a few things, like $50 to go see your PCP, $100 to see a specialist, $70 to see urgent care. So it's not going to be the richest silver plan that you see, but it is going to be the most cost-effective silver plan. In West Virginia, this has been plan that has sold great, and that's why we still have it there in West Virginia, quite frankly. Our low deductible silver plan. The Mountaineers love that low deductible of $5,000. It's going to be kind of similar to the low premium plan, just slightly richer benefits and cost shares. Also, those $3 tier 1 drugs, which is going to be a big deal. So our high deductible health plan, preventative silver, $6,500 deductible, $6,500 max. This is our only silver plan that is HSA eligible. And you'll see in the design, it is designed like an HSA eligible plan. There are no coverage until that $6,500 is met, with the exception of some certain drugs that will be available at $0. And I have a full slide to go through those coming up shortly. The diabetes silver plan, this has been a great seller for us. So we've done this this is going to be year 3. The first year we rolled it out, it did great. We got some feedback from agents. For example, a specialist visit used to be $80. We switched that to $50 based on feedback from agents. We also lowered the premium slightly the second year on that. That's going to be a little different story next year on the premium side of things. But it is our diabetic silver plan. There's a lot of $0 diabetic benefits that come with that. I'm excited to show you what those are in a few slides. Please note, you don't have to have a diabetes diagnosis to enroll in this plan. Previously, we've had people enroll in the plan because that's $6,000 deductible. So that is appealing to folks. Everyone wants a low deductible. We also have the Healthy Heart Silver Plan, which is essentially going to be like the same exact plan as the diabetes, except for those diabetes $0 benefits. You're going to get your Healthy Heart $0 benefits. And I'm also excited to go through that in a few slides. Moving on, off exchange only plans. It's important to keep in mind that these are all only available in Georgia, Indiana, and Ohio. So our silver plans here, we have a low deductible silver plan only available in Georgia, Indiana, and Ohio, which again, low deductible of $5,100 and not as rich as benefits. We have an additional HDHP plan that is going to be at $5,600 HSA eligible as well. And then our silver $5,100 chronic care drugs and service, which is essentially kind of a combination of the Healthy Heart Plan and diabetics plans on exchange, except taking that and making it off exchange. Please note, even on the silver side, all of these plans here, the on exchange, off exchange, going to be 10 to 15% cheaper off exchange. So if there are no subsidies, no CSRs, no APTCs, you want to go off exchange on that. And then gold plans. So unless you're in the ICHRA market, you're probably not selling gold plans too heavily. But ICHRA is kind of exploding lately. So if you're interested in getting into that market, pay attention here. So we have our gold 1600, which is our federal standard plan available in Indiana, Michigan, North Carolina, Ohio, West Virginia. Same thing as bronze and silver. Off exchange is going to be 10 to 15% cheaper. Our federal standard plan has a $2,000 deductible, $8,200 max out of pocket. And then drugs start at $15. Our core gold is going to be available in Georgia, North Carolina, and Ohio. Our low premium gold only available in Georgia and Nevada. And then our diabetes and healthy heart plans aren't just available on the silver medal levels, they're also available on the gold medal levels. And then we have some off exchange only plans, which is going to be another core gold plan with a $1,600 deductible, and then our HDHP preventative plan, which is also going to be HSA eligible with that $3,400 deductible and out-of-pocket max, but no coverage until you hit that. Chronic condition plans. So if you'll remember, when I said this is what makes our diabetes plan, I'm excited to talk to you about that in a few slides. Well, here we are a few slides later. Everything that you see on here is at $0 to the member if they're on a diabetes silver plan, diabetes gold plan, and they meet those prior authorization requirements. And not last year, but the year before that, we got some feedback that our prior auth requirements were a little too strict and kind of unnecessary. So last year we dialed those back and we made it pretty much bare minimum while staying compliant to be able to offer these drugs at $0 to our members. We got a lot of good feedback from the broker community. Not a lot of issues. The first year I was getting a lot of calls regarding those prior auths. Last year, not so much. But yeah, everything on here with that prior auth requirement is going to be $0. Now, the prior auth requirements vary by each drugs, but you can imagine that most of these are going to have some sort of diabetic diagnosis, whether that's a diabetes 1 or 2 diagnosis or even a pre-diabetic diagnosis. Moving on to our healthy heart, similar to the diabetes, we have a lot of $0 benefits available for heart conditions. The big one that I want to call out here, this was also on the diabetes slide I forgot to call out, but Jardiance is available at $0. And then you get your tests and screenings and all that good stuff. Moving on to our HD-HP Preventative Silvers. So this is that HSA plan. I don't know why it says Preventative Silver and Preventative Silver. It's just one plan. You can ignore that. But this is our HSA Silver plan. And what they did is they basically took all the diabetic benefits and all the healthy heart benefits and then combined them for that HD-HP plan. All of these are made available at $0. CMS has a rule that you can't offer any first dollar share on those HSA plans, but they do have a chronic condition exception. That's why all this is available at $0. And then some additional plan details, $0 telehealth through Teladoc. We did a presentation with Depth Research, and they told us that one of the most frustrating parts for marketplace members across the whole entire country was the cost of telehealth. And that kind of surprised me because we offer telehealth for free through our Teladoc network. It's important to note, most people think of Teladoc, they think I have a rash, I'm going to go on a webcam, show them the rash, and the doctor shows me what it is and prescribes me some medicine, and that's that. This is also available for behavioral health. I am depending on you agents to let your members know that. CareSource has tried educating it, but utilization still isn't up to where I would like to see it. I think that's an incredible benefit, $0 therapist appointments. So that's huge. It's also worth noting that on the behavioral health side of things, you stick with your provider throughout the whole entire plan year. So if I, Ryan Black, have a therapy session with Dr. Jim, the next therapy session will be with Dr. Jim again. It's not going to be with some Dr. Sue where I have to go explain my whole entire backstory. This allows me to build a rapport with that provider, build trust with that provider, and feel comfortable talking during that circumstance. So behavioral health is available for anxiety, depression, stress, substance abuse, trauma, relationships issues, and whatever else you would use the therapy for. And that is all at $0 through telehealth on all marketplace plans, regardless of meta level. And then we have non-essential benefits. So you can add vision and fitness for $3 to $6. When I go through these benefits, I don't see why everyone isn't doing this. This used to be dental, vision, and fitness. It was much more expensive than $3 to $6, but the feedback that we kept receiving from our brokers is the dental was horrible, and it was. I'm not gonna lie to you. Our dental was terrible. The benefits were great, but the vendor wasn't great. The network was horrible. The network accuracy was terrible. It just wasn't a good experience. We've tried to get a flex card approved, similar to what you see on the Medicare side, where we give our members like a $1,000 flex card on the year, but CMS denied that. So because they denied that, we went back to our brokers and said, do we want to stick with the same dental plan? And they told us, just get rid of dental, make it cheaper. So that's exactly what we did. So for $3 to $6, depending on what county and state you live in, more per month, you get vision and fitness. Our vision is iMed. These benefits haven't changed in, I think, probably 10 years, since I've been working on the marketplace at least. And it's because they're great. iMed's great. Never get any complaints about iMed. All these benefits on the screen are to all those members who get it. 40% off additional pair of glasses. They get their glasses every year, or contacts. 15% off LASIK if they choose to do that. So always a great benefit. And again, only $3 to $6 per month. Not only do you get your vision, but you also get fitness. So like on the DSNP plans, when I was going through Silver and Fit, Marketplace uses Active and Fit. It's essentially the same exact thing. They're both run by American Specialty Health, who you might hear me refer to as ASH. Over 13,000 gyms across the country, whether it's Anytime, Planet Fitness, etc. I do want to point out that some of these gyms are franchises. So just because Anytime Fitness in Columbus, Ohio is in network. That doesn't necessarily mean the Anytime Fitness in Cincinnati is in network. So please always go to that activeandfit.com or Silver and Fit on the Medicare side of things and type in the zip code to see which gyms are available in your area. You don't have to go to the same gym every time. You can also choose to go the home fitness kit route as well if your member doesn't want to go to a gym, which I totally get. And with that that gives me 15 extra minutes. Sophia, any questions that you have for me?
Nice. Amazing as always. So wonderful information. I really appreciate you, Ryan. I think that was the only one. Actually, let me go back. So when you were showing the FIDE plans, right? I know that, so in Ohio, you guys have a FIDE plan for the
Yes.
Medicare side. And then Georgia is Heidi, is that correct?
Yes. In Ohio, we are FIDE because CMS essentially gave the states an opportunity to choose whether they want FIDE or Heidi. And Georgia, they chose Heidi. Ohio chose FIDE. That's why even though next year there will still be some Heidi plans available in Ohio, every single one of them is going to be gone by 2030. Every single one. And after 2027, they're not allowed to enroll. So they can keep their plan, but they're not taking any new members.
Oh, got it. Okay, that's good to know. So then there's no need to like be switching per se. They could keep it if they want it, but if they want to switch it, then they can, pretty much.
Yes, but to the brokers here, there is zero reason to keep anyone in a Heidi who is eligible for a FIDE. The coverage is so much better on the FIDE side of things. Talking as a broker, I mean, obviously, as a CareSource employee, choose CareSource. As a non-CareSource employee, CareSource, Molina, and Anthem are all offering those FIDE plans in Ohio next year. Any single one of those would be better than any Heidi plan in the state.
Yeah. For Georgia, do you know all the other carriers that have also Heidi that are comparable? I guess just for our conversation's sake, Ryan.
I do not. I do not. I'm much more familiar on the DSNP side with the Ohio market. I do want to point out that on the Ohio market, Buckeye Health was one of the 4 carriers who won the FIDE bid. However, it failed their readiness, and they are protesting that. But now they're technically not allowed to move forward. So there's either going to be the 3 or the 4.
And I guess they're more like a local carrier, right?
It's Ambetter. They're owned by Centene.
Oh, really? Oh, interesting.
Yeah. It's Centene's Ohio company.
Okay.
Buckeye Health. They try to hide who they are.
I know I see that happening with a few carriers. That's interesting because we're like, I don't think we have that. That's good to know. Thank you. You're always a wealth of knowledge on the ACA side. Since I still have you for a couple minutes, I did want to ask. So, you mentioned West Virginia. Like last year, I remember on a roadshow, you mentioned how it was such a great space for agents to grow into, and I love that continues to be the case because I mentioned you said like there's barely any independent agent. So, agents from Virginia that maybe are closer to West Virginia would be good to focus there.
100%. And it's not just there's a lack of agents in the West Virginia community. There is a need for agents. There's a lot more consumers than agents have time to handle there. I think we saw like 76 agents in the state who sell marketplace plans. So there's a huge need for agents. So if you are in that Virginia area and you're able to get licensed in West Virginia, please do. Not only is it great business for you, but it's just great service to the West Virginia community who desperately needs agents.
Yeah. I love how you guys always show which areas you think will be like a good opportunity for the agents to help grow. I'm looking at like from the notes that I made from the presentation. I know so for the ACA side, so all the bronze will have the HSA eligibility. So that last bronze plan there, that it is the HSA that you showed, will be sunsetting. You said like next year, like it's gonna probably go away.
So I don't know if it's gonna go away. I just I'm not like that product designer, but as someone who knows the sales of it, I don't see the point of it anymore now that all the other plans are HSA eligible. Because if I'm a broker, the only benefit to this plan versus the other plans is going to be a lower deductible and lower out of pocket. but does that really offset having to pay out of pocket for everything before? If that, I don't know. So it could still be around. I'd be shocked if it was, though. I haven't been told anything.
Yeah.
And it's worth noting that's only available in Georgia and Indiana too.
Okay. And for your silver plans, since we're there, can we go back? So on the silver plans, I know that you guys have that wonderful diabetes plan that you've always have in the Healthy Heart. Are those like the coverage for the drugs that is similar to last year's, or there has been like changes to that?
There has been one big change, and that is Mounjaro being taken off the formulary. Now, it is worth noting that if you have a client who's on this plan who's taking Mounjaro and they get a doctor's note that says we've tried Jardians, we've tried the other ones, and they're having some irregular reaction to them, we will cover Mounjaro. But Mounjaro is off the formulary, and it's not going to be easy to get that covered.
You're right. Okay. So meaning like if a client has taken Mounjaro itself and they tried like the other GLP ones or other, I guess we'll call it not generic, but like I guess generic version of it, and they're like, no, it has to be this one, then you guys would make the exception after the doctor requests. But other than that,
that's not just a CareSource thing. That's every carrier is entitled to do that, by the way.
Cool. Yeah. And I know that generally there's a lot of carriers that just don't cover any anyway. So it's always been like a benefit of having CareSource as well. So that's good that you guys at least are doing, but accepting the other kinds of forms, right? For the other like diabetes drugs.
Yes. Another thing too, this isn't on the $0 slide, but Ozempic is available at $100 cost share on the diabetes silver and diabetes gold, which is still a really good deal. I don't know if everyone here knows how expensive Ozempic is, but it is much more than $100. It is not for weight loss. That is the prior auth requirement. There's a few things to it, but it's not covered for weight loss. It has to be for that diabetes diagnosis.
Right. Perfect. And then I'm just curious on the part of when you were showing the North Carolina map, you mentioned how Wilmington will be competitive. Do you have any other extra things you could share with us as to why you believe it would be like more competitive for?
So I'll start left to right in North Carolina. So previously, CareSource has had the bulk of our membership in the Asheville area. Unfortunately, based off the original filings, I don't think we're going to be super competitive in Asheville moving forward. I don't want to say moving forward, for this upcoming plan. The reason why I think we're going to be competitive down here. Now, keep in mind, all the states reopen their filings. There's a long backstory that goes into that. But on the initial filings, we did have that second cheapest silver plan. And that was a big deal in the Wilmington area. So that could be completely different. But from the last iteration I saw, we were looking very competitive in the Wilmington area, and we were excited about that. Oh, sorry.
Nice. Okay. Yeah, I was curious when you mentioned.
Honestly, not just in North Carolina, but across the market as a whole on the ACA side, in full transparency, it's really difficult for me in sales because let's go get all the membership. Carriers are essentially racing to try not to increase membership. This isn't a CareSource thing. Let's say every single carrier does new membership right now because they want to see how it plays out for a year before collecting new membership. My job at CareSource is to sell the heck out of it, and I'm going to keep doing that. So there are pockets of opportunity for you guys to go out there and sell. Off Exchange, ICRA, certain pockets of places in North Carolina and Ohio where CareSource and other carriers will be competitive.
Yeah. So yeah, here at Messer, we're actually trying to expand. We are expanding into like ICRA and offering the ability for the agents that are with us to get into that market and how to sell it. So see that you have your gold plan. So definitely will be something that will be able to, for anyone who is in the line or anyone that reaches out to us and want to find out more about it, we can help them.
100%. And if they would like to have some like one-on-one ICRA stuff, Sophia, reach out to me. I can set that up.
Oh, awesome. Okay, I will. Thank you.
Yeah, of course.
Okay. I mean, I will. These were all the questions I really had. Any agents that watch this and have questions, and if we can answer, we'll make sure that reach out to you and ask. As always, thank you so much, Ryan. I know how busy your schedule is.
Of course.
I really, really appreciate every time that we get together and then you go over your plans. I wish I had been able to go to the FMO Summit and all the other things that you guys do, but we were a little bit, our team
We'll
is small
see.
here. Yeah.
We're all just hanging on, Sophia.
Thank you. I hope you have a great rest of your week, and I hope to see you soon. Thank you everyone for joining.
You too. Take care.